Now we're going to look at Chapter 14. Chapter 14 is going to deal with principles of disease and what we also call epidemiology. So we want to look at pathology. Pathology is the study of disease. When we're looking at pathology, there's a number of things we've got to include. Etiology is one of them, and this is the cause of the disease. Pathogenesis is the manner that the disease develops. So like what steps does the patient undergo as they develop the disease? And then what are the effects of the disease? Does it cause structural and functional changes within the individual? This can lead us to infection. An infection is the invasion of a pathogen. So this is where the pathogen gets access to you and it starts colonizing you, meaning it starts to grow and gain more numbers. We then see disease though. Disease is the physiological effect of the infection. So this is the change in the state of health. So an example, you can have an HIV infection, but you would be asymptomatic. We don't see any issues with it, but your body is being colonized with that virus. When we actually start to see the physiological changes that happen in the body, that's when it's now the disease, which is AIDS. So there is a host microbial relationship. However, not all of these relationships are bad. One thing to note is that you have some normal flora located on your body. This is also known as normal microbiota. These are permanent microbial residents that are either in or on the body. The point of them is to help prevent invasion of pathogens. This is what we call the competitive exclusion principle. If they can live in that area better and they don't make you sick, they can outcompete the bad guys. They can outcompete the pathogens that are there. All right. And not two things that do the same thing can live in the same area. Factors such as antibiotic therapy can lead to disruption in your dynamic balance of your natural flora. This can allow opportunistic pathogens to then invade you. We see this sometimes when individuals have taken antibiotics. It can then kill some of their normal flora, which then gives opportunity for other organisms to make them sick. Transient flora are temporary microbial residents. These typically do not cause disease though either. So guys, right here on this slide, you're going to see that there is some normal flora that is located in multiple areas in or on your body. And so you can see in the nose, the mouth, the throat, the skin, the large intestines, the vagina, and the urethra all have normal microbiota that live there. They are there and they are actually competing to help protect you as long as they stay in those areas. However, you'll notice on this list that some of these also potentially cause illnesses. The reason is if they get the opportunity to move somewhere else in your body and they get an opportunity to make you sick, this can potentially cause issues. All right. But if they're where they're located here in this diagram, you can see then they're not causing you any problems. Another thing to note though, guys, on this list is you'll notice that majority of these are gram-positive bacteria. All right, so the majority are gram-positive. They are a mixture of coccus and bacillus, but majority of them are gram-positive. So when we look at this, guys, what do these body areas all have in common? If you'll notice, they all involve what we call cutaneous or mucosal membranes, meaning that they're dealing with openings. Like mucous membranes are always found in all of your natural openings, and so you'll see that they're located there. And then your cutaneous is dealing with your skin. What do most of these organisms have in common? Well, many of them are gram-positive microbes. All right, so when organisms live together and have some sort of relationship, this is called symbiosis. So symbiosis is where two or more organisms are living together. Now, this relationship of them living together could be beneficial for both, or it may be beneficial for one. These relationships can be described as commensalism, mutualism, or parasitism. So when we look at commensalism, this is where one benefits and the other neither is benefited nor harmed. So in this case, the bacteria is benefiting, you're providing nutrients and space for it, but it's not hurting you, but it's also not benefiting you. All right, you're not getting anything good out of it, but the bacteria is profiting from it. We also have mutualism. Mutualism is where both organisms will benefit. An example of this is we provide nutrients and space to the bacteria that reside there, but then they also aid us in something like digestion. Okay, they are actually able to help with digestion by providing us some vital vitamins. All right, so we're giving them good things and they are giving us good things in return. This is mutualism. The last one is parasitism. Parasitism is where one organism benefits and they're the parasite, and the other organism is harmed. They are considered the host. There are lots of different types of parasites. Viruses fall into this, pathogenic bacteria, the ones that make you sick, some protists, the example, the Plasmodium and the Giardia. We also see some helminths are also part of this. This would be like your tapeworms and your flukes. Now note here, typically normal microbiota are neither mutualistic or commensalistic. However, they can be opportunistic. This means they do become pathogenic only when a special set of circumstances does occur. So when we look at opportunistic pathogens, these are normally harmless organisms, but they can become harmful upon a number of things. The first thing is that they are relocated. They are put into a new area, which gives them different opportunities, which can potentially cause illness. One example is E. coli. E. coli is normal microbiota in your intestines. However, if it gets into the urinary system, it can cause a urinary tract infection. A break in the skin or a mucous membrane barrier can also cause some of these to be opportunistic. What happens is this, when it's broken, it weakens that first line of your body's defense, and it gives them an opportunity to gain access again into an area they don't normally have. If the host is compromised, this is going to be patients who are considered immunocompromised or immunosuppressed. This could be for a number of reasons. This could be due to like chemotherapy treatments. This could be due to transplants where they have to be on immunosuppression medication. This could be HIV or AIDS patients. But the patient has a weakened immune system, which makes them at a higher risk. All right, so let's look at the etiology of infectious diseases. So etiology is the cause, so what's causing them. And then when we look at infectious disease, a disease that is caused by a pathogen that is transmitted either person to person, all right, so you got it from somebody else, or you got it through a vector. A vector is something that carries it, like the example of a tick or a mosquito, or it could be acquired by environmental exposure. This could be from your food, it could be from water, things like that. Now, we talked about Koch in Chapter 1. Koch's scientific research was designed to establish correlation between pathogenic microbes and disease. He was able to look at the cause, what was causing, and then the effect, which was the disease. Okay, his experiment allowed us to be able to pinpoint certain microbes and know that they caused a particular disease. However, even with his work, there are some limitations. Not all organisms can be easily cultured, and since some can't be cultured, it's very hard to see how they're passed, and also who is actually the culprit of the disease. Some examples of this are Treponema pallidum, which causes the disease syphilis, Mycobacterium leprae, which causes leprosy, and some obligate intracellular parasites like rickettsia. Another limitation is that some infectious diseases, like pneumonia and meningitis, have poorly defined etiologies. We don't actually know the exact cause sometimes, especially when we look at meningitis. Meningitis could potentially be caused by a viral infection, a fungal infection, or also a bacterial infection. And pneumonia can be the same thing. There's lots of different things that could potentially cause the progression into a pneumonia or meningitis. Another limitation is some pathogens cause a variety of disease. And so instead of multiple things causing one disease, we see that in this case, this one bacteria can cause lots of different types of diseases depending on where it's located. The example here is Streptococcus pyogenes can cause scarlet fever. It could also cause cellulitis, erysipelas, rheumatic fever, post-streptococcal glomerulonephritis, and necrotizing fasciitis. And all of these cause a potential different disease, and based on its each of these has the same underlying cause, however, they do progress in different ways. So classification of infectious diseases, there are some terms that we need to look at. A lot of times when we're talking about a disease, we're going to see that there are some symptoms and some signs that come into play. Now, symptoms are subjective, meaning that the patient can tell you about them, but they're not things that you can actually measure. This would be where the person might tell you that they feel nauseous, or they have a headache, or they have vomited in the past. They're subjective at that point because you have not actually observed it. Signs Signs, on the other hand, are objective and they are measurable. This would be something like fever, high blood pressure, high heart rate. Those are things that you can actually measure and you can see them there. So I have a little thing here that talks about signs versus symptoms. Which one is which? So if we look here at the first one, lethargy or fatigue, this is when somebody tells you that they just feel tired. This would be considered a symptom, all right, because it's not something we can really measure. We have temperature. Temperature would be a sign. Anxiety, again, the person is telling you that they're anxious, that they have anxiety, so this would be subjective, so it would be a symptom. Tachycardia. Tachycardia is a high heart rate. This is something that we can measure, therefore it is a sign. Pain. Now, pain, guys, is subjective. Everybody has different tolerance to pain and things like that. That's why we use the pain scale, but we're relying on the patient to let us know, and so this is considered a symptom. A rash. When we have a rash on the skin, it is something that we can observe and see, therefore it is a sign. Numbness. Again, we cannot detect numbness, so it is considered a symptom. And then hypertension. Hypertension is a high blood pressure. We can measure this, therefore it is a sign. However, when we're diagnosing an individual, we are going to use both signs and symptoms to help us come up with our diagnosis to see what the potential issue is. Now, whether a disease is transmissible from host to host is going to know its spreadability. How easily can it be spread? All right, because if it can't be spread from person to person, this means that it's going to be a little harder for it to be transmitted. So when we look here, one term to look at is what we call communicable. This can be where it's spread from person to person. This is, in other words, it's pretty contagious. Okay, contagious means that it is easily spread, easily communicable. Example of this would be the flu. Okay, when people have the flu, a lot of times it's very easily to spread that, and so this is why a lot of times during flu season, if you go into a clinic or an ER, if you have flu-like symptoms, they'd like you to wear a mask, and the reason for that is to protect the other people because it can get passed very easily. Another example would be tuberculosis and also measles. There are some diseases, infections that are non-communicable, meaning they're not going to be passed from person to person. One example of this is food poisoning. Just because you got food poisoning doesn't mean that if you're throwing up next to somebody, they're gonna get it too. They had to have actually eaten the food that caused your illness, your sickness. Another one is tetanus. Tetanus is not one that can be spread from person to person. And another one is dimorphic mycosis. Now, when we're looking at communicable diseases, we say that these are infectious diseases because they could potentially infect other individuals. So let's look at a number of other terms that deal with the whole idea of disease and infections. So when we look here, one term we want to look at is called the incidence. The incidence is the number within the population that has the disease within a given period of time. Another term is what we call prevalence. Prevalence is the number within the population that has or has had the disease within a given time period. So if you look at this particular chart here, it's showing you that the incidence, okay, from year to year of HIV is actually gone down. Not as many patients are getting it as often, right? So if you look here in like 1983 is when it kind of spiked, then we moved down between 1992 to 2000 plateaued, and it then started to decrease a little bit up to 2010. However, if you'll notice, the prevalence has continued to rise because this is due to the fact that people, once they first get HIV, they don't die from it right away, and so they can live for years and years with having HIV. Another thing we want to look at is what we call frequency. We can say that the frequency of an infectious disease could be sporadic. This means that it occasionally happens, right? And so you can see here in this picture with sporadic and B, it's not very often, and it's kind of, there's not a pattern to it. We can say that it is endemic. Endemic means that it is constantly present in a particular population, therefore that we can see it's pretty predictable. We then have epidemic. Epidemic is statistically the disease is at higher levels than expected. So we knew that it was probably an issue in some areas. However, we see that it's even higher than it should be, than what we expected to be. This is an epidemic. All right. We've had different epidemics, but the flu is one of those. When the flu has way more people who get it than we predicted that would happen that season, then a lot of times we call that the epidemic. It can then change into a pandemic, and this is an outbreak of a disease on a worldwide basis. Okay, so a lot of times an epidemic, if it starts to spread worldwide, it changes into a pandemic. Now, this can happen pretty easily nowadays due to our ability to travel. The fact that you can get on a plane and pretty much fly anywhere you want in the world potentially causes the spread of diseases as well. The next thing we want to look at is severity or duration. So when we look at an acute infection, this means it has sudden onset, but it's also very short-lived. So it doesn't last very long. And so here in this particular diagram, you can see that it spikes pretty quickly, but then it also goes away pretty quickly. In the case of this would be like the flu or influenza. Some diseases are considered chronic. These develop gradually and they continue for a long period of time. When we look at this, some of them can also be persistent, like you see with mononucleosis, also known as mono. All right, and so when we see this, that it can go and gradually start to become a problem, but then it kind of spikes as we go. The last one here is latent. Latent is whenever it becomes active after being inactive. So this would be like a virus such as shingles or herpes simplex, where you don't have cold sores in your mouth all the time, but when your body is stressed or you've been sick with something else, a cold sore may develop because it got the opportunity to come back. The same thing happens with shingles. The person doesn't have shingles all the time with the blisters, but when their body is weakened or something triggers it, it could come back. So this would be considered a latent infection. Now, the extent of the infection is also important to note. Is it a local infection? This means is it restricted to a small area? So a lot of times, like if you have a head cold and it's restricted up here to your upper respiratory system, we would say that's more localized. However, it can also become systemic. This is a generalized infection throughout the body. This can occur if the cardiovascular or lymphatic system is involved, because this means that the invader has a highway to travel through the body. This could lead to a focal infection where it's going to be specific in a certain area, but the whole body still shows you some potential signs and symptoms. Some other terms we want to look at are things like septicemia. Septicemia is when there's organisms such as bacteria, viruses, or fungi, or also toxins that are located in the blood. Septicemia is also known as blood poisoning. We also have bacteriemia. This is where bacteria specifically is in the blood. This can actually occur just when you brush your teeth. As you're brushing your teeth, there is bacteria in your mouth that can get dislodged. If you end up, especially like if you have bleeding gums or things like that, you potentially can add these to the blood. We also have toxemia. This is where specifically toxins are in the blood, and viremia is viruses in the blood. Now, sometimes, guys, sepsis and septicemia are used interchangeably. However, sepsis is your body's inflammatory response that your immune system actually does, and this can lead to organ failure and septic shock. So it's a little different. So septicemia means that something is in the blood, bacteria, virus, or fungus, which could lead your immune system to try to fight it, which could lead to sepsis. All right, but sepsis is actually due to your immune system trying to overcome the potential invader. And again, this could lead to organ failure and septic shock. All right, when we look at some infections are considered a primary infection, meaning they're the initial infection, and then others are termed as secondary infections. Secondary infections are usually opportunistic pathogens who take the opportunity when your body has been weakened. So the patient initially has been diagnosed with HIV. That's the initial or primary infection. However, later, due to the fact that their immune system is weakened, they get pneumocystis, which is a secondary infection due to the fact that their immune system is weakened. Another example would be that if you have a bacterial infection present, and that's the first thing you went and got diagnosed for, however, later you still aren't feeling good, the bacterial infection could still be present, but now you also have a secondary viral infection. This happens a lot of times if you've had the flu or something like that, and they give you antibiotics, and they say, oh, this is for a secondary bacterial infection because of the flu. All right, so there are some predisposing factors that actually can lead to this. Gender can be part of it, as well as UTIs. A lot of times women are going to get urinary tract infections more often than men. This is due to the close proximity of the anus, the vagina, and the ureter, all separate, but they also are in close proximity, different than in males. We also see that stress, the more stressed out a person is, the more that their body is not able to fight things off. Also nutrition, if the individual has poor nutrition, that's an issue, but also even seasons. We have different seasons where stuff come into play, where we have allergy season, or we have cold season, or we have these different seasons that make things that where certain illnesses are more present. Other things that could also be predisposing factors include age. The older you get, the harder it is for the body to potentially fight things off. Also certain habits or lifestyles that individuals have, as well as even their occupation. Their occupation could put them at a higher risk, but also their occupation could cause more stress. All right, so these are all different predisposing factors. So now let's look at the development of the disease. When we first see the disease coming into play, this is called the incubation period. All right, so it's this very first part here. This is the time between when you were exposed and when you actually see symptoms appear. All right, so this is going to be where you've been exposed and now symptoms are appearing. And in some cases, this could be weeks or even months before you actually see this. This leads then to the next phase. This is called the prodromal period. This is the onset of the mild symptoms. So it's not too bad yet. You're not feeling terrible, but you do start to feel some of those signs and symptoms. We then actually have the period of illness. This is where the signs and symptoms are the most severe. This is when you feel the most sick. This then leads to the period of decline. This is when you start to recover. You start to feel better. Your signs and symptoms start to subside. That sore throat starts to go away. The ear infection starts to go away. The cough starts to go away. So it's the period of decline. Now, that's not the end, though, guys. There is a period called the period of convalescence. This is where there's a return to your pre-disease state. The issue with this particular state, though, is that you can still be a carrier of the infection or the disease. All right? You can still pass that on to somebody even though you feel just fine. Someone who is infectious but has no symptoms could be in this convalescence period. All right, so below on this slide right here, this is an overview of what is needed in order for an infection to occur. First, there must be a reservoir that harbors the pathogens. Then second, there must be a means by which the organism is transmitted to the host. Once it's inside the host must be susceptible to the disease. So if you'll notice, there's the progression. So we have something like the reservoir. The reservoir could come from another human. It could come from an animal. It could come from something non-living like the soil, water, or food. If it gains access into you, it gets transmitted to you. This could be due to direct contact. It could be indirect contact or even droplets. Okay, these droplets could be from like a sneeze or a cough that get into the air. There could also be a vehicle of water, food, or air, or vectors like arthropods, mosquitoes, ticks, that sort of thing. This stuff is covered like here in chapter 14. The transmission to the susceptible host is seen in chapter 15. This is where it has to actually gain entry to you. Okay, it can't just come in contact with your skin or just come in contact with your throat. It's got to have a way to gain access. All right, so its portal of entry, is it through a membrane? Is it through a break in your skin or a parenteral route? The organism attaches, but then it has to have a way to penetrate and invade your cells and invade your host defenses, cause your immune system not to be able to fight it right away. All right, and so that's your susceptibility. Can the invader overcome your immune system for at least a short time to gain the upper hand? So let's look at the spread of the infection here in this chapter 14. So when we see here, there are reservoirs. Reservoirs are the source. And again, they can come from other humans, where the human, it's passed from human to human. It could also come from certain animals, like the swine flu came from pigs. We also see there's non-living examples where they get the disease from the soil or contaminated water or food or even a fomite. Now guys, a fomite is an inanimate object which can be used to transfer an infectious organism. All right, this is where somebody potentially coughs in their hands and then touches the door or touches a desk, and you come by later and it's still able to survive on that surface, and then you potentially get it on your hand and then touch your face or something like that. All right, and so fomites can also carry this. So one thing to kind of note, guys, is that there are quite a few different types of organisms that are transmitted from animals to us as humans. These are known as zoonosis, and if you'll notice here, the different reservoirs can be a lot of different things, but they could be swine or birds, which are pigs or birds, bats, skunks, foxes, dogs, raccoons, horses, rodents, even domestic livestock, so like cows, donkeys. We also see even cats, deer could carry it, certain reptiles. And so you'll notice that there's a very wide range of these reservoirs of certain diseases that potentially can move from animals to humans. And they're listed here. Some of them are viruses, some of them are bacteria, some of them are fungal, some are protozoan, and some are even worms or helminths. All right, and so when we look here, you can see this reservoir. You'll also notice that each of these diseases is going to be talked about in different chapters. chapters. These go from chapter 21 to chapter 26, which we will look at in unit 3. All right, so some modes of transmission. The first way is through contact. Now, this contact could be in different ways. The first could be through direct contact. This is from person to person transmission. There's no intermediate object that's involved. So this would be coming from touching somebody or kissing somebody, all right? And so you're actually engaging with that other person. We also see indirect contact. This is where the agent is transferred via a non-living object. This would be like fomites. This could be from towels, eating utensils that might not have been cleaned properly, thermometers if they weren't cleaned, stethoscopes, bedding, clothes, even money. Money has lots of stuff that potentially can be transmitted on it, and syringes. The last one that's in the contact is the droplet transmission. These are microbes that are spread in mucus droplets that can travel short distances. This is less than 1 meter, but guys, 1 meter is about 3 feet. Some examples of this is when somebody sneezes, coughs, or when they're talking or laughing, if they spit, those droplets potentially could be carrying an infectious disease. Another way that things can be transmitted is through some sort of vehicle. This vehicle could be from contaminated water. We also see our food. If our food isn't prepped correctly and things like that, it could be contaminated, or if it's not cooked all the way through. This is why when you go to restaurants, they always have that disclaimer that if you choose to consume undercooked meat, you want your meat rare or medium or something like that, then they are not going to be held liable if you get sick, because when we cook things, we kill most of that stuff. We also see that it could be carried in air. Now, this air could be including body fluids like we see with sneezing or coughing, but it could also be where it gets pushed up into the air due to dust and wind and that sort of thing. The last way when we're looking here at transmission is through vectors. Most of our vectors are arthropods. Arthropods have jointed appendages. These are going to be insects, mites, ticks, mosquitoes, flies, and other types of bugs. They carry the pathogen from host to host. And so there's two different ways that the vector transmission could occur. One is through mechanical. It's on the insect's body, like the insect, like a fly, gets into the trash can, starts moving around, picks up something, then it comes in, it sits on your sandwich or the food that you're going to eat. It potentially could transmit to you. So like salmonella is one thing that can happen here, or E. coli. We also see that there could be biological transmission with the vector. This is going to mean that the actual arthropod bites you. It injects it into you somehow, whether it's through the bite or through the feces that it leaves behind on your skin. But whatever it does is it decreases the integrity of the skin by creating an opening, and this allows the pathogen to gain access. Some examples of these are things like the plague, malaria, yellow fever, typhus fever, Rocky Mountain spotted fever, Chagas disease, and Lyme disease. And we will talk more about these in further chapters. So if you look here, this is an example of some arthropod vectors. They list them out over here on the side. They're the arthropod disease vector. It tells you the disease that they cause as well in this chart. So this chart just shows you some of the examples of some potential arthropod vectors who carry different diseases. The next thing we want to look at is the susceptibility of the host. Is the host really young? Are they elderly? In both cases, their immune system is normally compromised. When we're young, our immune system is immature. It's developing. And so because of that, we are more susceptible sometimes to certain diseases. The elderly is the same way. The immune system is actually declining. It's not working as well. And so they are also more susceptible. Also, is the person immunocompromised? Is their immune system, does it have an issue with it? This could be due to an autoimmune issue. The fact that they have to take rejection medication for a transplant. There's a lot of different things that could cause somebody to be immunocompromised. This is the chain of infection. So the reservoir is where it's the source, where the potential disease is first located. It's going to have to leave the reservoir somehow. This is the portal of exit. This is then going to go to the mode of transmission. The mode of transmission is talked a little more about in chapter 15. It then has to gain entry into the new host. Once the new host has once it has gained entry into the new host, we have to look at whether or not the host is susceptible. If they are susceptible, then it causes the infectious agent to cause the infection. Now that individual is a new reservoir, and we see that the chain of infection can continue. If we want this to stop, we have to break the chain somehow. And breaking the chain a lot of times is to prevent the spread of the infection. So a lot of times it's either to look at the reservoir and also to look at that mode of transmission. Is there a way for us to break this cycle? Now, there are some healthcare associated infections. When we look at these, a lot of times they can be abbreviated as HAIs. However, they were formerly known as nosocomial infections. These are microorganisms that are prevalent in hospital environments. They are going to cause issues because these people are already immunocompromised somehow. They're compromised due to having surgery, due to having other types of infections present. The chain of transmission is normally direct and indirect contact. Those are the most common. This is where lots of different factors actually start to overlap, like you can see in the picture. We have those microorganisms in the hospital. We have the ways of transmission through direct or indirect contact, and we have a lot of compromised hosts. This gives a kind of perfect formula in order for these diseases to continually be passed on. So again, these are known as HAIs. So how do we control these nosocomial infections, these infections that are found in the hospital? Again, we must break the chain of transmission. One way to do this is to teach proper hand washing and make sure the employees and even guests really follow the hand washing. We also see the use of expendables. If we're able to use it one time and then get rid of it, that can actually help prevent it being transferred from person to person. Proper disinfection, making sure that things are disinfected properly, sterilizing equipment, and then also doing reverse isolation. Reverse isolation is for the benefit of the patient, not the benefit for the workers or the visitors. This is so that the workers and visitors don't bring extra stuff into that patient who's immunocompromised. Now, hospitals have infection control committees who actually monitor these infections, and they watch to see if there's a rise in them or if there's a fall in them, to see maybe what they're doing that's either good or bad in order to break this chain of transmission for these types of infection. This chart just shows you some common microbes that cause HAIs. When we look, percentage of total infections is shown here, and then also the percentage that are resistant to antibiotic are shown in the next column. There's an issue with this because we see that a lot of these are becoming more and more antibiotic resistant, which does make it harder for us to get them under control in the reservoir side of it. And so the whole point then is we've got to break it from being transmitted from one person to the next. This one is showing you the site of infections, what are most common. 32% are urinary tract infections, and a lot of times this actually comes from the idea of catheters, that sort of thing. You're actually taking something from the outside world and placing it inside the person, and so because of that, transfer can happen. Surgical site infections are 22%, lower respiratory is 15%, bloodstream infections are 14%, and then others go into this other 17%. All right, and so in this particular table, it shows you those and what are most common. All right, so this brings us to epidemiology. This is where they study the when, where, and how of a disease when it's transmitted. This will include the incidence and the frequency. How often do we see it? So we're going to look at when it occurs, where it occurs, and how it occurs. Epidemiologists are concerned with controlling the spread of the disease. We don't want it to continue to spread, and so it's finding out how that's happening in order to control it and stop it. One way that we do this is through case reporting. Lots of hospitals have certain things that they have to report on, and this case reporting may be used to establish or break the chains of transmission. Sometimes if it's a new issue, it helps us understand where it's kind of coming from in order to then break it. But again, knowledge is power in this case. So the more information we have, the more that we can use to actually break that chain. The Center of Disease Control, also known as the CDC, is the main place in the United States that this stuff gets reported to. However, there's also the National Institute of Health, the NIH, and there's also the World Health Organization known as WHO. They are also going to monitor emerging infectious diseases. These diseases are talked about in Table 14.6. So with the CDC, there are certain nationally notifiable diseases that they put on a list. So these are going to be reported to the CDC. These are going to be looking at issues of morbidity and mortality in weekly reports. They're known as the MMWR report. The whole idea of the reports of morbidity is the incidence, like how many patients are coming in with it. And then the reports of mortality is how many individuals are dying from it. And this is important because sometimes, like if we've learned that we had an outbreak of E. coli, and it was due to the fact that now we can trace it back to lettuce. This lets us know then that we need to educate people to say, hey, don't eat this type of lettuce, especially if it came from this place place, because now we have X number of people who have gotten the E. coli and we have X number of people who have died from it. All right, and those numbers can change, of course, depending on how those reports come in. So right here, guys, this is the emerging infectious diseases. Emerging infectious diseases means that they're new or changing diseases. This is where they're increasing, or they have the potential to increase in the incidence. So they want to watch them. They want to make sure that they're not becoming a potential issue. Now, this list, the microorganism, it tells you the year of emergence when they kind of came into play. It also tells you the disease it causes and the chapter that it's discussed. Again, you'll notice most of these will be discussed in further chapters. You'll notice that some of these emerging diseases are as old as back in the 1970s. The issue, though, is we want to still watch for them, because if they start to come back and be an issue, then they can be a problem very quickly. Some examples of this are MRSA, MRSA, VRSA. We also see Clostridium difficile, also known as C. diff, and a certain strand of E. coli. There are some other viruses that are also on this list, as well as some purons. With the viruses, this includes SARS, H1N1, which is a type of flu or influenza, avian flu, West Nile virus, Ebola, and HIV. If you'll notice, like for Ebola and even for influenza A virus, you'll notice that the years of emergence, there's more than one. This tells you that it may have come in a cycle, and we may need to figure out why they are a little more cyclic in that sense. For the purons, this is the Creutzfeldt-Jacobs disease, or the CJD. Now, we talked about how the CDC has certain things that need to be reported on a weekly basis. This is normally an infectious disease that is notable on a national level. This particular chart is from the year 2000. This gets updated constantly, of which ones, some can come off the list, but others can be added. One thing to note about this is a lot of these can be linked to scheduled vaccinations. A lot of these could potentially be prevented by some of the vaccinations that we do offer. The reason why we vaccinate is that we want to create what we call herd immunity. There are some individuals who cannot be vaccinated. One reason is they could be allergic to how the vaccine is produced, if they're allergic to eggs or things like that, and so they would not be able to take the vaccine. Others don't take vaccines due to religious reasons, and so because of this, if the majority of the population, at least 80%, is vaccinated, this creates what we call herd immunity. Herd immunity allows then for that disease to kind of stay away from those who cannot be protected from it due to the vaccine. The problem is, in some states, they no longer require kids to be vaccinated before they come into school, and sometimes their thought behind this is, oh, we haven't seen measles in a long time, we haven't seen mumps in a long time. Well, the reason we haven't seen that is due to vaccinations. We've had cases recently in Texas and things like that where measles has come back, mumps has come back, and that's because due to the low levels of vaccinations that are occurring. So we see here there's some scheduled vaccinations listed here. There's diphtheria, tetanus, pertussis, which is whooping cough, measles, mumps, rubella, hepatitis A, hepatitis B, polio, and then of course Haemophilus influenza type B is also another example. These vaccinations are available for some others, but are not necessarily routine. So there are vaccinations available for some of these others on the list, but they're not necessarily routine unless you have come in contact with it, or there's a chance you might come in contact with it, where it's not maybe an issue in the United States, but if you were going to go visit another country, they may want you to be vaccinated for it. There are some of these on the list that are actually foodborne, meaning that they are going to be, the source is going to be from contaminated food. Examples of this is like botulism, E. coli, listeria, salmonella, and shigella. These all cause different levels or severity of food poisoning, but they come from food. And so it's again important to report it, because then it can allow us to see if it's more widespread. Did it come from a certain supplier? Did it come from a certain kind of food? Or was it just due to the fact that that restaurant had an issue that day or a problem that day? Another example are some of these are sexually transmitted diseases. Again, this is going to be for us to be able to track again how education and things like that is going to help. Again, HIV and AIDS are part of this, cancroid, chlamydia, and this is genital chlamydia, gonorrhea, and syphilis. You'll notice that herpes is not listed here. It's not on the list. And the reason a lot of times with this is that herpes 1 and herpes 2 herpes is actually a very common virus that individuals have, but it's normally herpes 1 that we deal with in the mouth. And we'll talk more about these again as we get into different chapters. We also see that there are several on the list that are due to vectors. They're transmitted by certain vectors. Lyme disease is one of these. Rocky Mountain spotted fever, RMSF. Both of these are carried by ticks, certain kinds of ticks. We also see plague, and plague is carried by fleas. And yes, plague is still around. And then we have yellow fever that is carried by mosquitoes. Again, we want to watch to see if these come back into play and to see how they are potentially being transmitted in order to do vector control. Is there a way for us to control that outbreak or educate people in order to help keep them from getting the disease from these vectors? There's also some on this list that come from the zoonosis coming from animals. This includes anthrax, brucellosis, plague, ehrlichiosis, hantavirus, psittacosis, Rocky Mountain spotted fever, and rabies. Now, again, some of these are going to be transmitted through vectors, but some of them can jump directly from animals, such as like cattle, deer mice, parrots, things like that. All right, so this finishes up chapter 14. Again, if you have any questions, please let us know.